In my humble opinion, the barriers to aligning the healthcare workforce better from a racial standpoint with where we are as a population. So just to give the statistic, the estimate is approximately 5% of physicians in the US are African American or identify as Black or African American, and roughly 13 to 15% of our population identifies as Black or African American. So that's a 10% discrepancy, right? The the challenge in better alignment is I do think it is largely a pipeline issue of recognizing that the road to becoming a physician starts early, right? So how do we start with some of these fundamentals of the social drivers? How are children afforded opportunity to even dream of this? I love the saying, if you can't see it, you can't be it. How are we exposing children of color at an early stage to opportunities in the sciences and healthcare, STEAM, that is exceedingly important. And us taking a responsibility as a society of recognizing that programming has to start elementary school, then into middle school. Then how are we priming kids in middle school to prepare for the rigors of high school that gets you ready for college, and pre-medical sciences? I have some colleagues nationally who this is what they devote their work to, is pipeline programs. And it's so laudable. We need to invest more in those programs and thinking about strategy. How do we strategize with academic medical centers, bringing those centers to elementary school? There has to be someone who can liaise and link between the two, and systems investing and creating the linkage and the liaisons, I think, is critical. It's so important. I also think the support we give to historically Black medical schools is fundamental. Um, I loved the statistic that came out of Uche Blackstock's book about where we were with training Black physicians in the 1920s to now. Before, there were several other historically Black medical schools that existed that were shut down based on policy and regulation. So this is where we talked about structural racism. So the policies that were put in place that did not allow the historically Black medical schools to meet the bar of standard. And so those institutions closed, and we lost tens of thousands of Black physicians who would have potentially been trained to serve our current populace. We have 4 to 5 historically Black institutions. Um, Bloomberg just gave a huge hundreds of millions of dollars poured into those institutions to develop a healthcare workforce that will ideally better align with where we are as a population. And this is not preferential treatment. I think it's very important to say that, right? Like, this is righting a disparity.
Yeah.
Let's objectively look at the numbers. 5%, 15%.
Yeah.
We need a level up to close that gap.